What's up, vets? I'm Combat Craig, and I'm a 100% disabled Desert Storm veteran. Today's topic is teeth and mouth conditions. Here's my grill. Pretty yellow teeth. If you have questions about VA claims and you think that I might be able to answer it based on something that I said, please give me a call at 208-557-3084. I'm getting a lot of phone calls, and I call back as many as I can. So without further ado, VA claims for teeth and mouth conditions. So today I met a veteran named Floyd. Old dude. He's older than dirt. I'm older than dirt. 51. He's probably, I think he said he was like 75 or 77. Floyd told me he's missing a bunch of teeth, mainly from chomping on meds. Since he got out of Vietnam, which is obviously a long time ago. So the part that jumped out at me is he's like, hey, if all of your upper teeth are missing, that's a 30% rating because I've got it. It's like, wow, crazy. High value claim. I just really haven't thought about VA claims for teeth and mouth conditions a whole lot. TMJ a little bit. We'll talk about that. But just really, it hasn't affected me. And if you've watched any of my videos, I kind of stay in my own little disability wheelhouse. Not that I don't have plenty of teeth problems. I just don't have a rating. So I was like, wow, crazy. I mean, makes sense. Also, if you're missing all your teeth in the lower part of your jaw, that's another 30. And it's not pyramiding because it's two different parts. Another thing that stood out, this one was probably the most interesting to me, is even if you are outfitted with a shiny new grill, a gold teeth with Cadillac rims or whatever, whatever you did in the 70s or now, you get to keep your rating. It's different than a hearing loss claim because they're like, oh, your hearing sucks. So here's hearing aids and beat it. Here's your 0%. So you can actually get implants or dentures or like I said, I don't know what they do or what's available, but you get to keep your rating. Let me tell you about my awesome root canal. So I don't have a VA rating for my teeth, but I did get a shitty root canal from a Panamanian dentist in 1989 when we were down there kicking Noriega's ass out of there. So shitty experience. I came back. I was TDY. When I came back, it started hurting again. Root canals suck. That kind of pain. So I was back in there, and the dentist stateside was like, wow, great job this idiot in Panama did. So yeah, I call it my shitty Panamanian root canal. In 2004, that doctor stateside sucked too. So I ended up just pulling that thing out of my head. It was one of my back molars. It was like, you know what? I am over this thing. These root canals, you put these little twisties in there and go down. Then they fill it up with liquid. And if they don't, for whatever, something, the cement, like it didn't hold. And it's like, they just kept doing it wrong. And I was like, just yank it out of my head. When I got the root canal, my back molar yanked out. I was smoking cigarettes at the time. I'm pretty sure I didn't for 10 days, but somehow I still got a dry socket. So that's fun. Then they're back in there, digging in there again. Just really had bad experiences with the dentist. I'm looking at 4.150 schedule of ratings for dental and oral conditions. This is CFR 38 Part 4, the schedule for rating disabilities. This is where you can find the ratings. If you have specific problems with your teeth, you'll probably know how to pronounce a lot of these things better than me, but I didn't want to go too in depth. My main point of this video is that if you have dental issues, teeth conditions, mouth conditions, you can get some pretty valuable VA ratings for the mouth and teeth. So that's the main point of this video. A lot of words that I can't pronounce, your typical kind of stuff. Mandible, loss of, complete, 100%. Little less severe, 50, moderate, 30. You'll see that a lot. Severe, moderate, Doesn't bother you is a 0. Slight displacement of the mandible is a 0. Temporal mandibular articulation, limited motion of incisal range. 0 to 10 millimeters is 40, 11 to 20 is 30, 21 to 30 millimeters is a 20% rating, and 31 to 40 millimeters is a 10% rating. Hard palate. Here's one. Teeth loss. Due to loss of substance of body of maxilla or mandible without loss of continuity. So it has the loss of upper teeth, loss of lower teeth, all upper and lower posterior teeth missing. You got to get into the law and really understand this stuff. Well, Floyd has 30 for his upper teeth and 30 for his lower teeth. VA claims for teeth conditions are high value. You're obviously going to need a dentist. You're probably going to get a C&P exam from a dentist. So remember, you want to have your own dentist proving your claim, your severity of symptoms. Common rules apply. They're going to send you to a C&P exam. So you want to have your side of the story represented. Another condition that I'm familiar with, but I don't really know how to pronounce it, temporal mandibular joint dysfunction, otherwise known as TMJ. I know that TMJ causes all sorts of pain and tenderness of your jaw, aching pain, chewing pain, facial pain, clicking sound, grating sensation when you open your mouth. So a lot of weird things happen with TMJ. You're going to need a diagnosis, document the severity of symptoms, and a nexus letter. Lots of veterans that have PTSD have TMJ, so make sure that you're reviewing 38 CFR 4.150, the schedule of ratings for dental and oral conditions, and it's diagnostic code 9905. And check it out, see where you're at. But it's all about, how much you can open your jaw and eat, and, solid foods, liquid foods. Again, this more because you deal with it, but you need to get a doctor to actually explain it. I want to give Floyd a shout out. And check out this video here on the top 3 easiest VA disabilities to claim. And see if you can learn anything, see if there's anything relevant, and keep the phone calls coming.